we are back if everyone is ready. So let's go ahead and continue on our agenda. And we are at 6.3, our 11 a.m. item, consideration of update on COVID-19. And today with us, we have Dr. Gary Pace.
Hi, good morning. Thank you, Mr. Chair, and good morning to the board. Appreciate the opportunity. Can you hear me okay?
We can hear you fabulously.
Perfect. Okay, thanks. Thanks for the chance to talk today about COVID. I'm helping fill in while the county is continuing to look for the permanent health officer, and I'm just going to try to cover the highlights. Everything's changing pretty quickly, and I know a lot of the public wants to give their perspective at the end here, and I think we have people from Sutter and from Adventist to talk about the hospital situations as well. So Sarah's not available today, so I'll go over the data that she has prepared. And Sam, I don't know if you have those slides. If you could put those up, that would be helpful. If not, I'll just go ahead.
Matthew
I think I gave it to Matthew so that he could share his screen.
Matthew, if you can share the screen, please.
So I don't have it.
Oh, okay.
All right.
Well,
I'm sure it
Matthew,
could
I
take, I'm
emailed
sure
it
if we
to
just
you
wait 30 seconds,
just
we
a
can
few
take
minutes
care of that.
ago. If you can just, Matthew, can you check your inbox from within the last hour?
Yes, I sent it to Matthew as well. Let's see if we can do something else then.
Let's see. I can do a share screen.
Okay, yes, it looks like I do have it. Sorry about that. Opening it now.
I think you need to share the Google Docs screen.
Apologize for the delay. We're trying to bring up that attachment. It should be up momentarily.
I can go ahead and start talking as well, and then we can come back to it when it comes available. Thanks for working on that. I mean, the situation is pretty much similar to how it was last week, only worsening. Oh, here we go. So thanks. If you could go to the second slide, that would be helpful. So again, the situation's kind of the similar as it was last week. This is the looking at vaccinations. So vaccinations is the solution here, and we continue to. The blue line is the Lake County vaccination rate. It's basically we're doing about 100 vaccinations per day over the last week. So each day we're doing about 100 vaccinations, and you know, we still have 20,000 or so people in the county who are eligible but who are not vaccinated, and we're doing about 100 a day here. It's a little bit more than it was. So about a month ago, we were only doing 50 a day. So we've doubled it, but it's still very, very short of where we'd like to be. Next slide, please. So this is the slide continuing to show the numbers of people vaccinated. This big orange in the middle is the number of people that are fully vaccinated that are eligible, so a little over 50%. There's still 40%, this lighter color orange on the right, which is almost 40% that are not vaccinated at all. They're in the 12 and older range. Next slide, please. So these are the testing slides. So basically what it shows is this is in California is the blue, and the county is the top one, I believe. And but you can see that the testing rate continues to rise. So the question is are these positive test rates just because the test rate is declining and we're just seeing a skewing of the data? But the number of tests is rising, but the test positivity rate is also rising, which is concerning. So we're between 15 and 20% test positivity in the county, which means almost for sure we're going to continue to. This is the first thing that rises is the test positivity, then the next is the case rate, and then the next is the hospitalization. So there's a timeline with each of those. So because of this, we can anticipate cases continuing to rise in the coming weeks. Next slide, please. This is the confirmed cases. It seems like it's sort of flattened off over the last couple of weeks, and so we'll see if that continues. That's actually somewhat reassuring. And the total confirmed cases, so go to the next slide, please. And this is the epi curve, which I think that previous slide has a little bit of a lag. So this is the curve that basically charts the whole course of the pandemic in Lake County. This is Lake County, and you can see at the far right, this last week is actually higher than before. So we're continuing to see a rise here. So it looks like by all indications, we're going to continue to see some rises over the next coming weeks. Next slide, please. This is the breakdown of the cases in July. 50% of the cases are in this kind of younger age range between 20 and 45. 60% are white, non-Hispanic, 30% Hispanic, 5% Native American, and it's scattered through all of Lake County. And the main thing is it looks like it's community transmission is what we're seeing. It's a little hard to tell at this point because it's just so widespread. Next slide. So this is the hospitalization data. Again, continuing to rise. On the left is the hospitalized patients in Lake County, continuing to rise, and the ICU patients. And again, we're going to have, I think we're going to have a more direct discussion about this with Dr. Bloom and with Mr. Knight, the CEO of Sutter. So, and I think that's the last slide, right? Oh, yeah. Okay, so basically, the numbers are continuing to rise. We're starting to get very concerned about the hospital situation, and we're going to hear more about that in a little bit. When you're looking at Britain and India, where they're a couple months in front of us with the spread of the Delta variant, they had some huge problems, and then the numbers dropped after several weeks of being high. We're not really exactly sure why that is at this point. We're thinking it may be because it's moved through the population, so possibly that's going to be happening here, but we're trying to at least understand better what's going on and see if there's things we can do to help prevent the hospitals from getting overwhelmed. And certainly the data is very clear now in Lake County. The hospitals are full. We have some of the highest case rates in the state. We're one of 3 counties that are at this very high case rate. The vaccinated people tend to not be getting hospitalized unless they have underlying problems. So I think the overriding message here is vaccination, and we'll get to masking as well. The hospitals are full. It's hard to transport people out of the county. The regions are getting filled as well. Sonoma County now has 70 COVID patients in the hospital and 17 in the ICUs. So again, very concerning. The vaccines are the most important intervention that we have at this point. It continues to be very protective against serious disease and death. We are seeing more vaccinated people getting infected and spreading it amongst other vaccinated people. So it seems like where initially we thought the vaccinated people would not get infected, they can get infected, much less than the unvaccinated, but they just still seem to be protected against hospitalization and death. The current data is sort of estimating that people are 8 times less likely to get infected if they're vaccinated. So unvaccinated people are 8 times more likely to get infected with the same amount of contact. They're 25 times less likely to get hospitalized and 25 times less likely to die vaccinated versus unvaccinated. That's the most recent data that's coming out in California, and it's pretty much the same nationally. The unvaccinated people can have no symptoms or they can get really sick. So it's a whole spectrum. But the vast majority of the people in the hospital are unvaccinated, and children seem to be getting sicker, more likely to get infected and getting sicker than before. So whereas before we were thinking the kids were pretty protected with this new variant because it's so contagious, it seems to be less so in the kids. And we're not getting a whole lot of uptake at the vaccine sites around the county. And right now, like I said, we're getting about 100 per day over the last week. And so, that's 700 in a week, and we still have 20,000 or so eligible people that are not vaccinated. So in the fall and winter, probably is going to be bad. This wave will probably subside at some point in the coming weeks, but very likely it's going to get bad in the fall and the winter again. So getting the protection now will be able to protect you from there in the future. I think the masks are clearly helpful, and now we're understanding that even if you're vaccinated, you can get it and spread it. Wearing the mask is important. So universal masking is considered the prudent thing to do at this point to slow down the transmission around the community. And some people will say, well, why should I get vaccinated then if I have to wear a mask even if I've gotten vaccinated? And really, it's to save you from being hospitalized or from the possibility of death. And this is considered, we really pretty much consider this preventable for most people, that if you get vaccinated, you very rarely are going to end up in the hospital or dying. So the question comes around to what can we do here? What's being done in other areas or nationally to try to slow the spread, to try to decrease the hospitalizations and deaths. So there's new mandates that are coming out. The state is now mandating that vaccines for all healthcare workers effective at the end of September. And there are some religious and medical exemptions, but the healthcare workers are going to be required to be vaccinated now by the end of September. And this is pretty common sense for the folks to be around the sick people, to be around the vulnerable people, to have to be vaccinated. It just seems to be a smart thing. Law enforcement and first responders are in Sonoma County now. They're going to start mandating that fire and law enforcement and EMS show proof of vaccination or get weekly testing. So that's kind of a new thing, but some of the other counties are taking this as well, since there's so much contact with the public. All county employees, some like Sonoma County is going to consider having all county employees show proof of vaccination or get tested weekly, and they're taking that up, I think, next week at their Board of Supervisors meeting. Masking currently in Lake, the Board of Supervisors came out recommending masking in all indoor settings. Most of the Bay Area counties have made it mandatory for businesses with indoor spaces to require masking and leaving it up to the businesses to enforce that. There are some vaccine mandates that are coming about now. So the healthcare facilities, as I mentioned earlier, are going to be mandated to have employees vaccinated by the end of September. They are also starting to mandate proof of vaccination for visitors to healthcare facilities or volunteers that are working there. So they have to either show proof of vaccination or a negative test within the last 72 hours. Many indoor businesses are also requiring proof of vaccination, and some are beginning to require employees to get vaccinated. So especially some of the big employers like Google and things. So, I think part of what this is these are all different ways that some of the areas are trying to get ahead of this and trying to slow the spread and prevent the spread of the COVID and the hospitalizations that are going to result. So we probably ought to talk a little bit about schools. The school year is starting soon, and there's not been a whole lot of uptake in the 12 to 17-year-old range. As far as we know, the information that we were using previously before Delta was that kids tended not to get that sick, and if they did get sick, they tended not to get real sick, and they didn't spread it much. So a lot of the kind of guidelines that were set up were for pre-Delta. So I think there's an increased contagion factor now, and the state is requiring masking within the schools. But I think it's going to get complicated this fall with Delta now, and in ways that we're just now starting to get our heads wrapped around. I think testing and contact tracing, people should continue to test if they're symptomatic or in close contact with a case, and then isolate and quarantine. It's the same basic things as before. It's just this is much more contagious, so even more important to be meticulous about it. And if you get some symptoms, don't just attribute it to a summer cold. Go get tested, and if you're positive, you have to stay out of work and out of school and away from other people. Because the really important thing is the isolation. And because of the high number of cases now, and the state has taken away the contact tracing resources, we're having a lot of trouble through the health department keeping up with the contact tracing. But I think it's people kind of probably know the routine now, and basically should get tested and isolate if you're positive or if you're at high risk. So, so that's basically what I wanted to cover today. I mean, the virus is changing, the guidance is evolving, it's moving, it's changing a lot, and we're probably not going to be reaching herd immunity anytime in the near future. So I think that's not the way to think about it anymore. I think it's more like, how are we going to try to keep society open and moving with trying to minimize the impact, and trying to have the hospitals be functional so that people can still get the care they need and not be overwhelming the healthcare system. The vaccine is the key, and masking. These are the two big tools we have, and the more we can get people to get involved with that, the better we're going to see. We're not seeing, for the most part, we're seeing very few problems with the vaccine, and the testing continues to be valid and useful, and this is the way we're going to be able to manage this moving forward in the coming months, because this is probably going to be a part of our life now for the foreseeable future. So I just encourage people to take it seriously and get vaccinated if you're not already. Thank you.
Thank you very much. And I see that we have Dr. Bloom with us, and I do not see Mr. Knight. I know that it was a possibility that he would be here. It doesn't look like he was able to make it. So let's go ahead and open it up for Dr. Bloom to speak to us about his experience over at Adventist Health and how things are going over at the hospital.
Hi, good morning, Board of Supervisors, Chairman, Dr. Pace. Thank you for the opportunity to allow me to speak today. I wanted to be brief, but update everyone on the goings on in the hospital. So just as a quick introduction, my name is Evan Bloom. I am an emergency physician at Adventist Clear Lake. I've been here for over 8 years, and I'm also the Chief Medical Officer for Adventist Clear Lake Hospital. So to follow up on what Dr. Pace was saying, this morning I came to the hospital, I looked at our board, and we have 7 COVID positive patients in the hospital. That doesn't seem like a lot. Numbers wise, only 7 people, but we're only one of 2 critical access hospitals in the county. That means that there are less than 25 beds per hospital by definition, a critical access hospital, only 50 beds in the county. So normally we're actually running pretty close to capacity. And then when you can think about it and say, well, there's 7 patients, that's almost 33% of the beds in our hospital taken by a singular diagnosis. That's unheard of. That doesn't happen, but it has been happening with COVID. And it's really intolerable because it puts an enormous pressure on the staff, the hospital, and frankly on our patients. And what do I mean by that? Well, the impact of this is that while we are absolutely still able to care for people at this point, we're abutting a moment in time when it's starting to become difficult to do so. So what does that mean for you? Well, if you come to the emergency room because you need help and you have an emergency, that means that the emergency department may be full and there may not be beds. And so you'll be sitting in the waiting room for a period of time. But that period of time may be extended because when you're in the emergency room and you need to be admitted, well, if 1/3 of the hospital is taken up by those with COVID, then there aren't beds available to admit those patients. And therefore, everything comes to a standstill. And for those patients who unfortunately have significant emergencies and require specialty services that our hospital is unable to provide, we need to transfer those patients out to other hospitals that have higher level of care or specialty services. And the reality of the situation is that we are not alone in this surge, obviously. We hear about it on the news every day. And beds in Northern California are extraordinarily tight because of the numbers of COVID positive patients in the hospital. And therefore, if you need transferred to a hospital to take care of a heart attack or to have a surgery, Well, you may be sitting in the emergency department for an extended period of time because there is no place for you to go because there are no beds available. Again, I don't want to be doom and gloom, but I want to communicate to you transparently where we are. And while we still are able to care for patients at Adventist Clear Lake, it is a very significant concern that we are abutting this point in the pandemic, which can be very significant and very serious. So now that I've laid the groundwork for this, I want to reiterate what Dr. Pace was saying about the way forward, that vaccination is the best strategy. Vaccination is clearly the best strategy, but it is not an immediate fix. It takes time to get 2 shots. It takes time to build immunity. And therefore, to bridge to that point, that's why we're talking about masking again. Because masking is a way to immediately reduce transmission and reduce caseload, as you've been seeing with the positivity rates, the testing positivity rates increasing. That is a precursor to positive cases, which is a precursor to hospitalizations, which then leads to where I was just talking about. So I'm asking for your partnership. We have to do this together as a county. We have to work together so that we can continue to care for each other, and so that we as a hospital system can continue to care for you if you happen to be unfortunate enough to become ill, not just from COVID, but from anything. So I have to just say, as an ER physician working in the ER, which I still do on a regular basis, I want to just impress upon you that I have seen anecdotally myself very, very few, I think perhaps maybe one breakthrough case or case after vaccination. The people who I have cared for, and there have been numerous people that I have cared for with COVID, with mild COVID, moderate COVID, and very, very sick COVID patients, have virtually all been unvaccinated. Vaccination is key. And if you've been vaccinated, I probably haven't met you in the emergency department because you're not sick enough to be there. You may get ill, but you're likely not sick enough to have needed the emergency department and to have needed my services. If you are unvaccinated and you become vaccinated and you mask in the interim, I am unlikely to meet you in the emergency department. I'd be happy to meet you on the street, but I would be unlikely to meet you in the emergency department, which is not a place where we should meet. So once again, I will stop. I do not want to be long-winded, but I want to ask you for your partnership and your help from the hospital standpoint. We are here for you. Adventist Health wants to be able to care for you, but we need your help and partnership to allow us to care for the county, to care for those who are ill, and to not overwhelm our services. That's what I wanted to say. Thank you.
Thank you, Dr. Bloom. I don't want to speak for Sutter, but I know that we were provided yesterday some information that Sutter is experiencing some very similar situations with the number of beds that are being filled just by COVID-19. In fact, I believe the number of beds, the percentage was a little bit higher than Adventist Health. I don't want to provide the specific statistics just because I'd prefer it comes directly from Sutter, but wanted to at least elaborate on that, since it seems that we do not have Mr. Knight with us today, that they are experiencing the same situations, just as we are hearing that other hospitals outside of the county are experiencing those same situations, hence the lack of beds that we're able to transfer patients to. And Dr. Bloom, looks like you have something else to add.
I just wanted to also, and thank you very much, Chairman Spatier, I just wanted to make sure to make clear that if you need help, come to the hospital. We are here to care for you. We're here to help you. I am not saying do not come. I want to be clear. If you need help, if you have an emergency, come to the hospital. But I'm just asking for your partnership in trying to handle this, the outcomes of this pandemic, and to try to keep it from getting worse. To mask and to vaccinate. Thank you.
Thank you. Any comments? Supervisor Pyska.
Dr. Bloom, I really appreciate you coming on today and taking the time out of your day. And I appreciate your candor and illustrating what the experience is at Adventist. I know it's been a rough couple of weeks for all of you. Can you speak to how your staff is handling this excess work?
Thank you for the question. I am amazed. I am amazed by the staff in Adventist Clear Lake. The physicians, the nurses, the techs, the medical assistants, those who work in the cafeteria, even I truly am amazed because this has not been a week, this has not been a month. This has been, as we all know, quite a long time, more than a year. And people are still coming back. People are coming to work every day knowing what they're going to have to face, and they come in and they face it because we care about our county and we care about our people, quite honestly. They are still coming to work. And now, of course, as a way to try to stem this pandemic, as we heard about earlier, vaccination rates are just not enough, and therefore vaccination is now mandatory for healthcare workers. And so this is just another way to try to stem the tide of the pandemic and its effects. And so these are another thing that our healthcare workers will be having to do to try to help the population of the county. All I'm going to say is that it's very difficult day in and day out for staff to deal with this. Resources are thin, and I would ask you if you know anybody who does work at the hospital or who works in healthcare to let them know that you appreciate them. Because hearing that is always helpful, especially when day in and day out it feels like a grind. So that's all. Thank you.
We truly appreciate the dedication of all the healthcare workers in our county, and the fact that they keep showing up every day is a testament to that dedication. I have a question for Dr. Pace. Just maybe you could clarify. We hear a lot that people have already had COVID or thought that they have had COVID. Can you speak to what the advice is? Should they get vaccinated? Should they go through with that if they've already had it or thought they've had it?
Yeah, thanks, Supervisor Pyska. That's a great question. It's the evidence seems pretty clear that the immunity from the vaccine is stronger and broader than the immunity from getting the infection. So people that got the infection earlier are getting reinfected with the Delta variant. So I think as these variants go, they will figure out ways to elude the immune system. And by using the vaccine, we seem to have better protection. There's fewer people that are getting reinfected after the vaccine than after previous infections. And this thing's going to continue to keep mutating. So we're going to have further variants down the road. So there's really, the recommendation is very clear. Go ahead and get the vaccine. It's not going to hurt you if you've had the infection before, and the protection is better and probably longer and probably broader than just from the infection itself.
Thank you.
Thank you very much. Supervisor Crandall?
Yes, thank you. Thank you, Dr. Pace and Dr. Bloom for your reports. I just had a question actually for Dr. Pace, or either or. One of them first is there a requirement now for service members in the military to get their vaccinations? I don't know if you...
The way I understand that is that they are planning on making that a requirement once the FDA comes through with full approval. So they're basically signaling now that they are going to require the vaccine for active service military It's just a matter of timing and kind of getting things lined up properly, I think.
Okay, thank you for that. And the other question, and it might have been mentioned, was if someone contracted COVID, let's say last August or whatever the case may be, is there a lot of people that are repeating COVID patients, so they've had it before, never been vaccinated, and then caught it again?
Right, I think that's what Supervisor Pyska's question. Are you seeing that, Dr. Bloom, in the hospital?
I have seen that. I have seen a few cases of that. It's not like that as a particularly common phenomenon, but I have seen it more than once, which speaks to to post-COVID immunity. While it certainly occurs, is more rapidly waning, so it goes away quicker, and it's not as strong as is the response that has been seen from vaccines, which has also been proven by evidence-based studies and population studies.
Thank you for that.
Thank you. Any further comments? And actually, I'm going to pause and open it up for Director Pomeroy.
Hi, thank you, Chair Sabatier. I just wanted to also remind the public that we have plenty, I'm trying to turn on my camera. That we have plenty of slots open left. The OptumServe site down in Lower Lake, we are in the process of expanding their hours from 8 hours a day back to 12 hours a day, which is what we had during the surge in the wintertime. They are doing testing on Monday and Thursday and vaccination on Tuesday, Wednesday, and Friday. No appointment necessary. You can go to myturn.com on our public health website and get an appointment, so you don't have to wait, but they still have capacity and we're expanding their hours. We also have capacity at the health department. We are doing vaccines on Monday and Thursday, opposite days of OptumServe. From 8:30 to noon, and then we are doing testing on Tuesdays and Wednesdays, 8:30 to noon. We're only seeing about 40 to 50% of our appointments being filled up, so we have lots of appointments available. Please call the health department or email the Mohawk line to get an appointment. As those appointments fill up, we will expand our hours. So I just wanted to put that out there. Also, all of the clinics, the 2 hospitals, the systems, Adventist, et cetera, they have, through their providers, you can get tested or vaccinated. And a lot of the pharmacies throughout Lake County also have the vaccine. So we just want to let the public know that you can get vaccinated and you can get tested in Lake County. Thank you.
Thank you very much for bringing that up. And in fact, I was hoping to discuss a little bit about some of our efforts with our vaccine clinics. And it seems that right now we have a very come find us approach, and hoping that it's possible to work maybe with the city of Lakeport or the city of Clear Lake, where every weekend they have weekend concerts, that maybe we can have a vaccine booth available where that we can be where the people go. Rather than expect them to always find us and come to us, which may work for some, but may not work for others. So hoping that we can find ways to do that, maybe working with Adventist Health, who does have a mobile clinic, or working with Sutter, who might be able to provide the same service, so that we can try to be in as many areas as we can, especially when people congregate together in large crowds, so that we can make sure that we have that available. And I said large crowds, and I know some people get very nervous about that, but the concerts that I've been to, the parks are huge, and it's easy to social distance and be safe. And I appreciate the fact that we're still able to make those kind of events occur in a safe environment, because I think it's important for people to be able to be with the community and not just be isolated on their own, which unfortunately was part of our process in last March for a while. It's important that we have the ability to socialize together and feel like we're a part of something bigger than just ourselves. So I think that there are some other options, and I'd love to speak on that a little further, maybe privately with public health, and see what's possible, and see where it is that I might be able to assist in making those things happen as well. Any
Yeah,
further comments?
we completely understand that, Chair Sabatier. We are working with the state on trying to get a strike team, a mobile team here, that we can have all around the lake every day. We're in that process. We've put in the request. We have not received our answer yet, but we're hoping to receive that in the next day or two.
Okay,
So definitely we can have an offline conversation for sure.
okay. And Supervisor Simon? Your microphone.
Denise, thank you. Yeah, welcome Denise, Dr. Pace, Dr. Bloom. I appreciate the report today. But I do want to talk about, what Chair Sabatier just said. We have one of the largest events we have in Lake County coming up. We have the Lake County Fair, and really want to encourage us to do everything that we can to, whether it's the public health department or any of the other providers that are giving vaccinations in the county, that we take that opportunity to really to have a presence there and to give an opportunity to folks going to the fair. I don't know exactly what that looks like, but we know that's going to be a large event. We know everybody's wanting to be there this year, and if we could use that large gathering as an opportunity for vaccinations or other opportunities in our community. Hopefully we can focus on that going forward. But I do agree with getting it out to our businesses, our business owners, and other things to partner with whoever can bring a vaccination to the area or their job. Just encouraging folks, if they want to get it, having that opportunity to get it. And once again, this is a personal choice. You check with your health provider and get the answers to the questions if you're on the fence. But having that opportunity out there for the folks is bringing it to them, I think is really going to help us move forward. But I did just want to piggyback, obviously, on that we have the Lake County Fair coming up, and we could do anything to encourage to have some vaccination opportunities at that large event that everybody's going to, that we work on that between now and then. The other thing is too, when this first started last year, we had some real challenges with the amount of time that the testing was coming back. Can I get an update on the amount of time now that it takes to get the results back once you have a test, if that's improved, or just get an update?
Denise, do you know? Because my experience is where I'm working most of the time now is it's 24 to 48 hours. It's a very quick turnaround in my experience at this point. And I think the OptumServe folks, if you get it on one day, usually within 48 hours, it's back. That's been my experience.
And that's correct, Dr. Pace. We're seeing 24 to 72 hours, with 48 hours being the average.
Excellent. Yeah, I just wanted that, I know we had some real challenges with that in the beginning, but getting those tests back obviously definitely helps folks. You talked about it earlier. If you think you've been exposed and other things, act on the cautious side for isolation until you know what's going on. Like one other update for, our community, our constituents. Has there been any advance? I think there is, not promoting anything, but I know there are some self-home tests too that are out there. I've seen CVS has a test, and just want to make sure there's opportunities there. If folks don't want to go and get those, that we at least continue that information out to the public. So, I don't know, are there any updates on the self-home tests?
I have not even heard of that, Supervisor Simon. So they do have the Binox Now tests that are out there that you can purchase at pharmacies and, your local stores. Dr. Bloom, I guess you've heard of it. Really quick, before I turn that over, Supervisor Simon, we are already planning on being at the fair. We've already got our application and stuff in for our booths for vaccination. We're also partnering with Tribal Health to be in Kelseyville later this month, early September, I believe. So we are working with our local partners to gather resources together, because the health department can't do it all by ourselves. We don't have enough staff or capacity, but our partners are working with us. So we are looking to do those types of events.
Thank you. Thank you for that information.
You're welcome.
And Dr. Bloom, you had a comment on the home test.
To echo what Director Pomeroy said, they are generally, as far as I know, they are generally antigen-based testing, and that would be different than the PCR test that you get at the hospital or that you get through some of the other testing areas, which are PCR-based testing. So it's a different way that the test is performed. So that's what the Binax Now kit is an antigen-based test. And it's just slightly less sensitive than the other testing performed at the testing centers, but that should be available at the pharmacies. Regarding pricing, I'm not sure. I think it's variable.
Thank you very much. Supervisor Scott?
Well, I'm really thankful that we're moving forward and making sure that we have a presence at the fair, but I think we need to do more than that. I think we need to be giving some sort of incentive, because I would have to say almost everybody from Lake County will attend that fair at one point. We need to have some sort of incentive in place there at the fair, maybe working with the Fair Foundation and see if we can't give free passes into the fair or something. We have this opportunity that weekend to hit almost everybody in Lake County, and I think we need to be thinking outside the box and moving forward with something to incentivize getting the vaccination.
Thank you for that comment. Yes, Supervisor Pyska.
I absolutely agree with that, and we have, I think, just enough time to pull that off if we start now. I also wanted to talk about incentives and bringing it to the people. We have an opportunity to do that for our staff and make sure that we are making it as easy as possible for our staff to get vaccinated. And if that means people come in, a couple times a week or whatever, we're communicating with our staff to meet their needs, to meet them where they are. And it's probably time for us to also start talking about incentivizing our staff to get vaccinated, those who have already been vaccinated and those who will be vaccinated. So I think we need to start those conversations as well.
And I would suggest, based on our agenda item today, that that's something that we bring back rather than hash out a little further today, just to make sure that we stay within compliance of what's on our agenda today. But please, love to have that conversation. I think the rest of the board would love to have that conversation too. I mean no offense with what I'm going to say, but I think we need to move with a sense of urgency. I appreciate that there's work being done and that in September something is being planned with tribal health, and I do not want to stop those gears. But let's see how we can work together more efficiently to get things happening now. And I know that there are things happening, but I think we're lacking on more proactive measures than waiting for people to again come to us or waiting for things from the state. I think that waiting at a time like this is probably not going to get us the best outcome. So again, I think offline I will have those conversations, but I think we need to move with a greater sense of urgency. And I appreciate the hard work that public health has done, similar to the work that our hospital staff are going through. It's tireless, it's endless, and when you think you're done, here it comes again. So I empathize with those situations, but in order for the health of the public to be at its best at this moment in time, I think we need to move very quickly and hastily, but methodically all at the same time. So we'll have those conversations offline so we can figure out how we can make things happen. Supervisor Simon.
One final comment. I know that, when we started this, we went through, obviously, a very tough time as we got going. And just one comment I want to make that, we are all in this together, whether it's the business community, individual cities and other things like that. I know that there was a blue collar committee that was set up, when we were talking about those, Supervisor Crandall was on, Supervisor Brown. But I think too, messaging out to our communities is our business owners, our area merchants associations and other things like that. We all need to come together. We're all in this together, and businesses need to realize, that there are opportunities out there to partner with other folks that can give vaccination, not just the public health. Other agencies are doing that. That you look at all opportunities to put this in front of employees and give them an opportunity and hopefully help encourage that. So Supervisor Sabatier, I agree, being proactive, but it also, as business owners, we all need to look at the safety of our employees and everything. We do that here at the county. We're having those, Supervisor Pyska brought that up here with those conversations. But from our business communities, we need to do the same. The ultimate goal is to keep businesses open, to keep us thriving and rebuild our economy. And now it's time for some of our business owners too to step up and bring those opportunities right to the doors of their employees. So I do want to say that as we're all in this together, as we've always said. And the number one goal I know of this board and myself are keeping our businesses open, and the vaccinations are an opportunity to do that. So looking at that and, a partnership with our business communities too.
Absolutely. There is one other topic that I did not touch on yet, and I know I met with Supervisor Pyska yesterday and Dr. Bloom, and this was part of our conversation. I would like to work as a group, Supervisor Pyska and myself, with administrative staff and public health on messaging. I think we need to have a more robust messaging program. I think we need to ensure that we utilize all potential platforms and that we make sure that we're reaching out to the largest number of people of all. So that is something that I feel that we do have messaging, but it's sporadic, it's not consistent, and it's definitely not touching as many people. I think we could do better. So again, something that I will bring in conversations, but wanted to make sure the board was aware that is something that I feel we need to move forward with and enhance. If there's no further comments, then let's go ahead and open it up to the public. And first up in the Zoom room is Mayor Dirk Slutin from the city of Clear Lake.
Can everybody hear me?
We can hear you just fine.
Great. Conservative radio host Dick Farrell and vaccine critics dies of COVID-19 complications a couple of days ago. His friends and family said that Farrell urged others to get vaccinated on his deathbed. At the last city council meeting, I made a passionate plea for all city employees to get vaccinated for the COVID-19 virus. Both my wife, Karen, and I got vaccinated in February, but early last month, Karen was diagnosed with COVID again and showed all the symptoms of the virus: coughing, short of breath, headaches, and no energy. Karen has a compromised immune system. And when she contacted her doctors, she was told that if she had not been vaccinated, she most likely wouldn't have survived the COVID-19 virus. Last week, an unvaccinated cousin of her died from COVID complications. I urge everyone to get vaccinated for both your protection and the protection of your loved ones. I personally sent a memo to all city employees, and if they haven't been vaccinated, please get vaccinated, and I'll personally pay them $100 for everyone that get vaccinated by September 15th. And I urge now the county to put an incentive bonus of $100 for all county employees that are not vaccinated to be vaccinated again by September 15th. I hope that these incentives will get more people to get the vaccine, because that, at the end, in my opinion, is the ultimate solution. We can't just fool around with partial and not complete programs to put the tide to this virus. Thank you.
Thank you for your comment. Next comment is from Julia. We could barely hear you. Not sure if you can get closer to the microphone or...
How about now?
Perfect.
Okay, great. Okay, my name is Julia Bono, and I have a background in scientific research and nutritional healing. I'm here today to communicate to the board some scientific facts about the prevention and treatment of respiratory viral diseases like COVID-19 by natural methods as potential effective alternatives to riskier, unnatural interventions like vaccination that remains in the experimental stage and has already demonstrated many adverse reactions in breakthrough cases. I firmly believe that under no circumstances should such vaccines ever be mandated when such safe and effective, inexpensive natural alternatives exist. First of all, numerous studies and my own observation have shown that the preventative nature of readily available supplements like vitamin C, vitamin D, and zinc, especially in combination. Another natural treatment uses pineapple, which contains high concentrations of bromelain and vitamin C that have been shown to result in both a faster decrease in mucus and a speedier recovery time in respiratory infections. Bromelain is an enzyme with powerful anti-inflammatory properties that helps reduce swelling in the throat, nasal passage, and airways that often accompanies respiratory conditions. Pineapple also improves digestion and lets the body more easily absorb nutrients it needs to fight off an invading respiratory virus and recover more quickly. In fact, one study showed using pineapple extract helped people recover from their respiratory conditions 4.8 times faster. The relatively natural and non-toxic antiviral colloidal silver has also been demonstrated effective in both preventing and treating coronaviruses. A simple and inexpensive treatment protocol for coronaviruses that cause the common cold is to spray the nose and throat with colloidal silver. For lower respiratory infections, the patient can inhale a fine mist of nanocolloidal silver using an inhaler. While prevention might be seen by ingesting lower colloidal silver dosages of 10 and 30 parts per million, stronger colloidal silver concentrations in the 500 parts per million range may be required to treat more serious cases. I also want to highlight the key role of body pH levels in coronavirus infectivity. Extensive research has shown that coronavirus infectivity is notably sensitive to pH, and this phenomenon will probably also apply to the SARS-CoV-2 virus implicating COVID-19. For example, studies show the MHV-A59 strain of coronavirus is quite stable at an acidic pH of 6.0, but becomes rapidly and irreversibly inactivated by brief treatment at an alkaline pH of 8.0, while human coronavirus strain 229E is maximally ineffective at pH 6.0. Maximally infective at pH 6.0. Infection of cells by coronavirus 859 at an acidic pH of 6.0 is 10 times greater than that at a neutral pH of 7.0. Research also suggests that the coronavirus IBV employs a direct low pH dependent virus cell fusion activation reaction. Fusion of the coronavirus IBV with host cells does not occur at neutral pH, and that fusion activation at low pH dependent processes with a half max flow rate of fusion at pH 5.5. Little or no fusion occurred above a pH of 6.0. The viruses that cause bronchitis and colds thrive in an acidic
Your 3
body
minutes
environment.
are up.
Keeping
If
pH.
you could please finish.
Okay. Sorry, summarize. Okay, alkalizing pH change can quickly be effected in humans by following a raw plant-based diet where only uncooked plant-derived foods are consumed, as well as by using inexpensive alkalizing agents like sodium bicarbonate administered orally or
Is that
intravenously.
your last
Another
comment?
study showed that following acidifying low carbohydrate, high protein diets were 5.5 times more likely than those following alkalizing plant-based diets to suffer moderate to
Your 3 minutes
severe
are up. Can you
COVID-19
please give me your final comment? And that's it.
COVID-19 symptoms. Well, the researchers concluded that a plant-based dietary pattern may therefore be considered for protection against moderate to severe COVID-19.
Thank you for your comment. Next, Ahava Rose. And I mean this in absolute kindness. If you slow down, it makes it easier to understand what you're saying. Whether I agree or not does not matter, but if you want people to actually hear what you say, slowing down actually helps.
Good morning, and wow, good afternoon. I sat here for the last 3 hours watching nothing but dollar signs roll behind all your eyes, so I know you're not going to agree with anything I say. So how about this? According to VAERS, over 12,000 have now occurred with weeks to catch up on their data. There's plenty of unreported data and cover-ups from other systems, while the Harvard studies that I mentioned over and over have claimed that the VAERS system catches less than 1%, maybe 1 in 40 events. And you're here allowing this to be made available to children. Not just that, but you're here on camera conspiring to coerce and incentivize people to get this vaccine. And may I remind you again of the federal law prohibiting and stating that COVID-19 vaccinations are not only a choice, but there's a federal law prohibiting any persons from being coerced to take the experimental vaccine. May I also remind you, or maybe inform you, that Webster changed its dictionary of vaccinations this year to include DNA therapy, gene therapy. Yes, that's what happened in the last 2 years. Not only that, but 80% of those put on ventilators died. people put on remdesivir. I'm gonna organize myself for a second, actually, because I want to talk about how we're going to keep moving and minimize impact and reduce hospital occupancy. I'm going to spell it out. Ivermectin. Yes, ivermectin costs pennies on the dollar. But why won't any of these doctors talk about it? Because they're funded by big pharma and they want to get paid for these vaccinations that aren't vaccines. Budesonide, Budenoside, hydroxychloroquine. These are all very safe and very effective treatments that have gotten people with pneumonia out of the hospital in 3 days. In 3 days, when the doctors projected them to be in the hospital for 7 to 10 days. How about high dose intravenous vitamin C? But you know what? Rates aren't enough because you say these injections, the rates aren't high enough. The amount of money that you're paid to promote these treatments. They're safe, they are effective, and America's FrontlineDoctors.org gives plenty of information providing their effectivity. But how about more data for you? Gibraltar, 100% of their population has been vaccinated, but they've recently seen a 2,500% spike in cases. The Delta variant, how do you test for it? How are you testing for a variant based on something that has only been sequenced digitally? There has been no isolate. And how many children have died from this vaccine? Over 400 now. And now you're saying you want businesses and organizations to mandate these experimental medical procedures, but businesses can't enforce even registered medical devices like masks. And you still want to violate our HIPAA rights and get our medical information.
Your 3 minutes are up. Thank you very much for your comment. Next is phone 1113. And I believe if you're on your phone, you want to dial *6 to unmute. It looks like you're still muted right now. Okay, we'll try again later. Let's go with phone 6478. There we go.
Can you hear me?
Yes, we can.
Oh, okay. My name is Madeline, and I like to urge you again to give us more time. 3 minutes isn't enough, and you have so much time you take to reveal your side and what you like to accomplish, and we don't have enough time. There is so many riches around and no bigots. It's really, it's science, it's all clear, and the people can really do footnotes that it's totally true, and we have to lay this out on a platform and make it clear what we like to say, and we don't have enough time, so please give the people more time who like to talk a little longer. I take less time, and so somebody else could take a little more. So I give my time, I pass it on. So please, we need more time. Thank you so much.
Thank you very much. Next comment, Linda Fugati Hatfield. Hopefully I said that correctly, but please let us know your name, and you have 3 minutes.
Hi, can you hear me now?
We can hear you just fine.
Oh, okay. My name is Linda Fugate Hatfield, and I'm from Lakeport. And I just wanted to give a moment to just say that we keep hearing people throw up about the Beers reports, and those are unverified reports. It scares people when they hear all of these thousands of deaths, and those are unverified. Those have not been investigated yet. And I just wanted to reach out to some people that are listening and go, don't count on those until there have been several agencies investigate all of those reports. It does nothing but scare people. Thank you for your time. Thank you, Dr. Pace. Thank you, Dr. Bloom. Thank you, Denise Pomeroy. You guys have all rocked this out, and thank you to all the board for taking the time to listen to all of us and do the best you can to help all of Lake County.
Thank you for your comment. Next is phone 6205.
Good morning. Can you hear me?
We sure can.
Thank you so much. I want to somehow allow all of us to take a breath and come back to our town here. And I want to talk about what's happening at my grocery store, where approximately 4,000 households shop. It's in the Riviera. And it's a small market, and it's staffed mostly by young people who look like they are just out of high school. There might be 15 or 20 employees at any one time, none of whom have masks on. And in the last 3 weeks, very few, if any, of the shoppers have masks on. And when I've called the store to ask about their policy, what I was told was they will only act when the Board of Supervisors acts and publicizes it. That is the only situation that they will respond to. So I'd like to ask all of you, I know we all go to the grocery store. Please, when you go to yours, look around. See who is masking, who is not. What do you think would reach those people? Because they're not getting your message. Your message is clear here in the Board of Supervisors. I so appreciate that. But when you go out in the world, they're not hearing it. I don't know what to do about it, but I'm hoping that you will increase your outreach and your messaging, at least to grocery stores where we all go, and to take action in such a way that people hear that the Board of Supervisors is united and taking action on the behalf of the county. Thank you.
And your name again?
Bart Levinson.
Thank you very much. Thank you for your comment. Next, phone 2689. Again, please give us your name, and you have 3 minutes.
Can you hear me?
Yes, we can.
Hi, my name is Christina, and I'm not a scientist. I'm not going to try to convince you of anything on that level. I do, however, wish to urge you how important it is to do research and to listen to sources outside of mainstream news and voices. There's information out there from some highly esteemed scientists who are now being completely dismissed as quacks and censored. One such scientist, his name is Dr. Robert Malone. He is actually an inventor of the RNA technology platform. He has come forward concerning the numbers of deaths and adverse reactions to the vaccine and the successful repurposing of other drugs against COVID-19 when used early on. That's the key word, early on. People have been sent home when they came to the hospitals early on and told to go home, come back when you can't breathe anymore. So no one will make billions from these older drugs, these that could be used as a repurposed drug. We as a people, that's a quote from a larger document, you may recognize that, are in danger from some other fronts. And I just want to once again urge you to examine information that's available to you from other sources. And I too don't believe I've used my 3 minutes, and I donate it to someone else. Thank you for listening.
Thank you for your comment. And the last hand I see on the Zoom room is phone 1113. Let's see if we can get you to unmute this time.
Yes, can you hear me?
Yes, we can hear you. Please give us your name, and again, you have 3 minutes.
Yeah, this is Dr. Will Tuttle. Okay, as you know, I've been speaking to you regularly for the last few months as your constituent, doing my best to bring the light of truth to this darkness of deception that's covering our whole county and our whole country now. And we can see that the big pharma-controlled medical establishment and the mainstream media are rolling out and creating this case-demic to injure and control people, to close small businesses, transfer wealth and power to the elites that are controlling the government and the corporations. And as we heard a little earlier, really consider the fact that right now, for example, the territory of Gibraltar in southern Spain has the highest vaccination in the world for COVID, with 99% of the people fully vaccinated. They're having an explosion of COVID cases, 2,500% increase. They're having everyone now locking down. Everyone has to wear masks. So this is what you've been dreaming of. It'd be like Gibraltar, get virtually 100% of Lake County so-called vaccinated. And as you can see, it's not a solution. The same is true in Israel, another extremely heavily vaccinated place. They're having a terrible time with COVID. 95% of the new cases there are in vaccinated people. The obvious thing is that we are being extremely gullible and thinking that we're getting a COVID so-called breakthrough case when actually we're getting injuries from the vaccine itself. And the hospitals and the doctors are calling that COVID. So I'm trying, as a friend, really, to reason with you that this is a Trojan horse. If we're going to continue to insist on being so gullible and to believe this, then we're going to find our health deteriorating. It's well understood that these injections create harmful spike proteins, and they're also causing blood clots. People are calling it the clot shot. Micro blood clots, billions of them, that clog up the veins and capillaries in our body, causing respiratory problems and circulatory system injuries, heart inflammation, and severely harming people and slowly killing them. Young people are dying of heart attacks right after the clot shot. I just talked last night to a friend in Santa Rosa who told me that his vaccinated friend had a 14-year-old son who got the shot and was found dead in his bed 2 days later. This is outrageous and tragic, and it's all being covered up. If you're honest, you'll agree you don't feel as well as you did before the shot, unless you were lucky and got a saline one. But then you're going to have to take a booster, and then another booster, and the toxic boosters will never end. Is that how you want to live your life? The American Indians learned through bitter experience not to trust the government. Every so-called gift they got was actually a way to destroy their culture, pollute their bodies, and kill their spirit. How ironic this all is. Now, more than ever, we have to question this narrative and realize that the health department, the medical establishment, the media, and the government are all parrots with blinders on, repeating what they've been told to say. Thank you for caring. Thank you very much. That's all.
Okay, thank you for your comment. And looking in the boardroom, do we have any comments in the boardroom? Please come to the microphone. Again, give us your name, and you have 3 minutes.
John Moss, Jessica Weiska, you asked for stories. I want to know how to get a story to you.
The reporter's right here.
What?
We have the Record B reporter right here if you want to.
Oh, to give her the story?
Just, we want to start hearing people's stories in the community, so you can.
Oh, not to give you personally the story. Okay, thank you. I just wanted to know.
Sure.
Thank you very much. Let's bring it back to the board. Looks like we have no further public comment. Supervisor Pyska.
Yeah, so we have talked about sharing stories, and hopefully we can work with our media partners. We have a Record B reporter here today. We have Lakeco News. We have social media. If people want to continue to share their stories, that would be really wonderful. I just really want to express my gratitude. We have 2 medical doctors here who have hands-on clinical experience dealing with this pandemic. They're working in the trenches, and they are giving us their reality day to day. So I want to thank both you, Dr. Pace and Dr. Bloom, for being here today and sharing your very visceral experiences with us. As we saw in our data, 50% of our cases are 20 to 44-year-olds. So that is those are our working people. And I really encourage businesses to take the steps necessary to protect your staff. We're seeing many of our restaurants close temporarily because they have a small outbreak and they have to clean and they have to recover. So if our businesses can step up, talk to their staff about masking, about getting vaccinated, that will go a long way to protecting us in the grocery stores and us, when we want to go out and support those businesses. So, it's up to all of us. We have to continue to work as a community together. And really our only way forward is to mask in the short term and get vaccinated in the medium to long term. Thanks.
Thank you very much. Any other comments? I do want to kind of bring this back to Dr. Pace and Dr. Bloom. I do have a question because VAERS oftentimes gets brought up. I think it's misunderstood. This is not a medical doctor reporting forum. It's a public reporting forum. But I also believe that some of the pauses that we've seen worldwide on vaccination, I know that I believe it was the Johnson & Johnson was on pause for a moment here in the United States. I believe it was due to blood clotting. And I know there were other pauses as well in Europe that I believe those were based on verification of VAERS reporting, and whenever anything threw a red flag, that they would do further studies. Can you please elaborate on that if one of you has a response for that?
Well, I mean, Dr. Bloom may have something to add to it too, but I can tell you that these side effects and negative outcomes are being tracked very closely, and the public reporting is helpful, and that you're right, that goes into the reporting system. But like when the clotting problems were picked up with the Johnson & Johnson vaccine, basically it reached a threshold, they shut it down for a while. A lot of people were vetting the data and trying to make sense of what was going on. And then a decision was made that the risk of people not getting vaccinated was higher than the risk of people getting vaccinated. And so then there were certain sort of precautions put in place to try to warn people, especially certain groups that seem to be more at risk. So, I mean, nothing is risk-free. And so I agree with everybody that it's very important to track what's going on and to follow the data. It just seems like the data sources get confusing sometimes. And I would just like to reassure people that the professional organizations are extremely concerned about side effects from these, but we're weighing out risk versus benefit at any point in time. And people that have been very concerned about vaccines in the past made certain calculations about risk and benefit. For example, nobody in the Western Hemisphere is coming in contact with polio virus. And so to make a decision about polio vaccine is sort of a complicated process. And, overall, the medical establishment has been very clear that vaccinating the population against polio was a really good thing because it keeps it out of the population. We don't have to worry about it anymore. And the risks versus benefits were clear. In this case of COVID, though, it's a new vaccine. Everything's moving very quickly. We're trying to understand things and trying to get in front of it so that we don't have these appalling death rates that we're seeing. But people in the medical professional vaccine world are taking very seriously these side effects. But the difference is that from polio or some of these other viruses is that you will come in contact with COVID. You are coming in contact with it when you go to Walmart. And if you're vaccinated, your chances are much, much lower of coming down with something serious. And so, I think there's a lot going on behind the scenes that isn't necessarily being considered with some of the data that's being thrown out here in the meeting now.
Thank you very much for that response. Just looking through my notes from what was said, I think it's strange to claim that the vaccine is a ploy from Big Pharma, but yet also stating that doctors are ignoring medicine brought to you by Big Pharma. It's kind of like the PCR test. If the PCR test is bad, then that means the death rate is even worse. So I think the arguments don't hold water. It's not completely well thought out, and just it's a partial tactic of information that does not quite compute when you really think about it logically. The other issue is natural alternatives. You know, it's good to be healthy. It's good to lead a healthy lifestyle. We're talking about blue zones right now in the area. You know, have your activities so that you are exercising your body, eat healthy, eat vegetables, eat fruit. But the fact is we have 4.1 million people that have died worldwide from COVID, and we got to do something more than just offering the healthy alternatives, because it's not enough. This is why we have had vaccines in our history. This is why we have the medicine that we have, because the natural therapies are not enough to be able to decrease the death rate to a point that it's tolerable and acceptable. And if we could do better, then we should be doing better. We can't just shrug our shoulders at 4.1 million deaths. And just looked up Gibraltar. They only had 9 new cases yesterday, and they have a total of 43 active cases. So this idea that they're having a 2,500 or 25,000% increase is not correct. Yes, people who are vaccinated are getting the Delta variant, but also there are 0 deaths happening in Gibraltar, which is kind of proving the point that was stated by Dr. Pace and Dr. Bloom, that you are less likely to succumb to hospitalization or death if you are vaccinated. And they are extremely vaccinated in Gibraltar. They have one of the highest percentages, and it's with Pfizer. It's not one of those other vaccinations that unfortunately has been unapproved by many, many nations across the world. And so it's showing what we need to see. And right now, we know we have an enemy. We know that they're knocking on our door, and we're choosing not to pick up a weapon to protect ourselves. This is a weapon to protect ourselves. If we choose not to, we're going to have to deal with the circumstances of how that enemy is going to handle us. And right now, the situation in our hospitals are dire. We need to try to reduce it. And I'm just asking our community, please use a face mask when you need to use a face mask. It is not the end of the world to help protect your community. It's not about you. It's not about me. It's about us. It's about our community. And please think about getting vaccinated. It is going to help you and your family. It is going to provide protection, which is exactly what we want to do, so we can move on and start talking about other things. Dr. Bloom, I saw your hand up and then it went back down. Not sure if you still had a comment.
Thank you. Thank you, Chairman Sabatier. I did not want to interrupt what you were saying, as it was quite important. I wanted to just dovetail onto what Dr. Pace said and just mention a few things. I want to be perfectly clear and say that I do not personally receive money from any pharmaceutical company. I do not receive money from Pfizer. I do not receive money from Johnson & Johnson. I do not receive money from Moderna. So my recommendations are also not coming from the media. And when I was public health officer, they were not coming from the media. And what Dr. Pace says, I think that I can safely say does not come from the media or from a news outlet. We base recommendations on science. When we say science, we mean evidence-based research. Particularly, there are different types of studies that can be done. And the primary study that we want to see is something called a randomized placebo-controlled doubly blinded study, which is the gold standard for medical research. And there are a lot of these studies which are now out there looking at a range of different types of treatments for COVID-19, ranging from what was discussed during the comments, ivermectin, budesonide, vitamin C, folic acid, ascorbic acid, thiamine, that's vitamin B1. There's a range of them, and over the course of time, there have been many treatments for many different illnesses, ranging from penicillin to snake oil. And so you need a way to differentiate here, and that is what science helps us to do by looking evidentiarily at does it work or does it not work objectively, and not listening to the media source of your choice, because that does not help us as a people to move forward and to actually say what works and what doesn't work. So I wanted to make that point. I wanted to make the point also that we can talk a lot about different things, but correlation is not causation. So just because something happened to someone that had the shot, or something happened to somebody that I know, doesn't mean it was the cause of the outcome. That is, again, what science looks at. It looks at all these different things and what might confound, which is confuse, the outcome, and try to tease out what is actually causal, not what happened to be there when something else happened, and then say, oh, that caused it, because that is something that can cause a lot of problems. And studies and science go through, leap through many hoops to avoid that correlation issue and saying it's causation, because they are very different, and you can get pushed down the wrong pathway if you're not careful with that. So those were the main points that I wanted to make. I don't want to get down in the weeds with the other issues. Thank you.
Thank you very much. Looking to see if we have any final comments before we go ahead and close up this item. Thank you very much both to Dr. Bloom and Dr. Pace, as well as Director Pomeroy, for being here with us for this item. Unfortunately, we're not out of these weeds quite yet.
Thank you both for coming today.